Okay, so it's 10 o'clock at night and you're getting ready for bed. You decide to blow your red, puffy, sore nose one last time before you lay down and throw the used tissue in the wastebasket that is already filled to the rim with other used tissues. You empty the wastebasket, put it near your bed so the tissues don't pile up on the floor in the middle of the night, and you prop your pillows up. You realize that you're in for a long night because you're having a hard time breathing, you have congestion, sore throat, you're going through uncomfortable temperature variations, and getting through the night seems like the biggest feat. You wake up the next morning and you feel lousy, so you drag yourself to the doctors to await a diagnosis. Sometimes bacterial and viral infections pose with the same symptoms, so deciphering between them can be pretty tricky, which is why antibiotics are not over the counter, they are prescribed. Doctors have the common knowledge and the qualifications to be able to prescribe these antibiotics, whereas the general common Joe, like you and I, we don't really know what we can use to treat our infections if we do have bacterial infections or if we do have a viral infections. And the difference is viral infections have to run its course. They cannot be treated by antibiotics, whereas bacterial infections can. Now, when you go to the doctor and you're waiting your diagnosis, the doctor diagnoses you empirically off of observation of the complications and the signs and symptoms that you present at that time. So they basically judge you they base it off of judgment, and this is where it gets controversial because if you have a bacterial infection, they have to do lab work, and usually these labs take about a day or two. So if they feel that you have a bacterial infection, they just give you a broad spectrum antibiotic, which covers every bacteria until they can actually find out whether or not you actually do have a bacterial infection. If they feel that you have a viral infection, they just can give you medication that will alleviate your symptoms. Now, a health reporter for CNN stated in her statement, her study on bacterial antibiotic resistance, that part of the problem is that patients demand antibiotics and doctors are overeager to treat infections. Both doctors and patients have to do better. Sometimes patients are uneducated about antibiotics. They go into the doctor thinking, I feel really lousy today, I just want this to be over with, give me something to get rid of the symptoms. And so they don't really understand that sometimes antibiotics won't always do the trick. Together, overprescribing from doctors and the incorrect use of antibiotics can lead to bacterial resistance. There are those stubborn people out there who don't go to the doctor because they feel they can run its course, which is good. If you're viable and healthy, build an immunity. That's good. You want to do that. But sometimes when you let a infection prolong, it can lead to sepsis, which is the spread of the bacterium throughout your body, or it can lead to sequelae, which is a secondary complication due to the bacterial diagnosis that you did not tend to first. It's important to know when to use antibiotics and how to use them so that you don't create antibiotic resistance. There was a study done by a bunch of doctors, and they published the study in the Journal of Antimicrobial Therapy. In this study, they studied the patient adherence to prescription antibiotic therapy, and they related to how if they skip doses, they would actually develop antibiotic resistance with that prescribed antibiotic. Out of 7,120 participants, 65%, that's over half of the participants, said that they stopped their antibiotic therapy because they felt better after a while. So they figured, hey, I don't need to take this anymore. But this situation leads to one of the leading problems of why we have antibiotic resistant therapy. This becomes a problem because the doctor usually prescribes an antibiotic and they give you they tell you to take 1 to 2 pills a day, and they give you about a 7 to 14 day supply, which is a 1 or 2 weeks, and they give you the full set to ensure that this bacteria can actually be killed. Well, when the patient stops midway through, that's not guaranteed that the bacteria is actually killed. So if the bacteria isn't fully killed, it can come back 10 times worse, and the antibiotic that you were taking might not even work. So this results in having to heighten the dose of the antibiotic, or it involves actually having to change the antibiotic altogether. The CDC reported that 50% of prescribed antibiotics by doctors within the past year were not necessary for the patients. And this may not seem like a big deal, but it is, and here is why. According to the AMR, which is the Antimicrobial Resistance Report, which the CDC shared, it predicted that by 2050, antibiotics will no longer be effective. The death toll globally caused by resistant bacteria can add up to 10 million deaths and $100 trillion towards trying to prevent these infections. And these are infections that we can prevent already, so why would we use them to the point where they can no longer work? Regular surgeries such as hip surgeries, or if you needed a transplant, would not be able to happen because we can't use prophylaxis antibacterial therapy to kill off germs to be able to open up someone and do the surgery that is needed. On top of that, things such as a paper cut could be actually fatal to us. Kevin Outerson, a health law expert at the Boston University, stated that if we do nothing, you can look at antibiotic resistance as a slow-moving global train wreck that will happen in the next 35 years. More concerning is that there are 50 pharmaceutical companies that conduct research on new medications and distribute them throughout the U.S., and 47 of them have ceased any new research towards antibiotics. They have done this because the antibiotics that we have now are viable and they should work, but it won't work for those who misuse the antibiotics. On top of that, when they put forward new research towards a proposed superbug that will happen, that's still building, but it's not quite there yet, they're not going to make any money off of it until we actually get to the part where the superbug is created, and we don't want to get there. And the problem is, even if they did start the research today, it would take years to research a new drug that could proposedly kill this superbug that we don't even know exists yet. And added to more years onto that, it takes years for clinical trials and to even be approved by the FDA. If we keep going at this rate, microbes will once again take over mankind. It shouldn't be too scary though if we take action and we partake in the proper use of antibiotics. This dilemma could potentially be turned around.